This video is for educational purposes only and is not medical advice. Always follow your prescriber's guidance and speak with your healthcare professional about any concerns. So you've started tirzepatide and you're still feeling hungry. What's going on? If this sounds familiar, you're not alone. A lot of people expect their appetite to disappear completely once they start this medication, and when it doesn't, they worry something's wrong. But here's what's really important to understand. Feeling some hunger on tirzepatide is actually more common than you might think, and it doesn't necessarily mean the medication isn't working. Let's break down why. Tirzepatide is a prescription medication approved by the FDA for type 2 diabetes and for chronic weight management in eligible adults. It works as a dual GIP and GLP-1 receptor agonist, which means it activates receptors in the brain regions that control appetite and fullness. It also slows down how quickly your stomach empties, so food stays with you longer. Together, these effects are designed to reduce how often and how intensely you feel hungry, but they don't flip a switch that turns hunger off entirely. Tirzepatide modulates hunger signals rather than eliminating them. So what are the most common reasons you might still feel hungry? First, timing. Tirzepatide starts at a low dose and gradually increases over several weeks. Full appetite suppressing effects often don't kick in until you've been at an effective maintenance dose for a while. If you're early in treatment, your body may still be adjusting, and that's completely expected. Second, individual response. People have different levels of receptor sensitivity, different metabolic rates, and different hunger baselines. What works strongly for one person may feel more subtle for another. That's just how these medications work in the real world. Third, consistency of administration. Taking your dose on a regular schedule, exactly as your doctor prescribed, helps maintain steady levels in your system. Inconsistent timing can affect how well the medication works. And fourth, lifestyle factors. These matter more than people often realize. What you're eating, how well you're hydrated, your sleep quality, your stress levels, and your physical activity can all meaningfully influence how effective tirzepatide is at managing your appetite. It's also worth remembering some hunger is completely normal and physiological. Your body still needs fuel. The goal isn't to never feel hungry, it's to feel hungry less intensely, less frequently, and to feel satisfied with less food. Now, when should you bring this up with your doctor? If you've been at your maintenance dose for around 12 weeks and you're still experiencing significant hunger, that's worth a conversation. Same goes for if your appetite was well controlled and then suddenly increased, that's a change your prescriber should know about. And if hunger comes with other symptoms like excessive thirst or severe abdominal pain, reach out to a healthcare professional promptly. Your doctor can help assess whether your current dose is appropriate, whether your timing makes sense, and whether there are other factors at play. Never adjust your dose on your own. Always follow your prescribed plan and your doctor's guidance. To recap, feeling some hunger on tirzepatide is common and doesn't mean the medication isn't working. Where you are in your treatment, your individual response, and your lifestyle habits all play a role. And if persistent hunger is a concern, your healthcare provider is the right person to talk to. Remember, this video is educational only. It's not a substitute for personalized medical advice from your prescriber. Have you experienced this on tirzepatide? Drop a comment below. We'd love to hear what's been helpful for you. And if you found this useful, give it a like and subscribe so you don't miss what we cover next.